Here is the Haas survey. So Haas is conducted to see the improvement of a patient's overall health. And this is done in terms of the physical and mental health, monitoring physical activity. So this comes down to getting a PHQ-9 done on your patients, making sure that we're doing the different pain assessments that we talked about, talking about fall risk. And this is done yearly. CMS hires a vendor actually to do this. And it ensures that patients are getting these different things done when they are seeing you, but also it helps CMS kind of see how are patients improving. Are they getting better? Are they getting worse? Did they have any falls over the year? And if they did, what happened? What was the outcome? So this is another component of the STARS/HEDIS measures, and all of these different components get tied in to come up with your STARS rating. And if you think about it, how much of this do you really have control over? Well, the control that you have as a physician, that we have as providers, is to ensure that every time we see a patient, we listen and we're doing as much as we can to remind them of these things, to remind them of maintaining and completing physical activity, going for walks, making sure that they don't have any rugs in their home that are causing them to fall, because that will help them remember that you did talk about falls. If you just say, have you had any falls? They're not going to remember you talking about falls. But if you tell them, do you have night lights in your bathroom? So when you get up in the middle of the night to use a restroom, you can see you don't trip and fall. That will help them remember if you can tie a story to these fall metrics that they have.
So HOS stands for Health Outcomes Survey, right?
Yes.
And so you have to be thinking about two things. Number one, the patient's health has to be good, getting better, improving. And number two, the patient has to be aware of it. One of the critical pieces is patient awareness of what's going on with their health. Mm-hmm. So back to 5-star. We talked about how 5-star is critical. Payments, your relationship with Medicare and the payers is very much driven by your 5-star rating. Your 5-star rating is also published to the public. So it's very, very important for your patients as well. Now, there are major components of 5-star, and that is, they are HEDIS, CAPS, and HOS. Anything else?
No, those are the big components that you've got to think about when it comes to HEDIS/STARS. But I think the other component and the other big piece of this Medicare Advantage model is, of course, when it comes to risk adjustment. And I think that may be a good place to go next. I don't know. What do you think?
It is. Let's just finish this video out and we'll get into a little bit of risk adjustment. Risk adjustment, by the way, is very big, very complicated. Dr. Patel and I worked full-time with him for about 3 years, training docs in a very, very large system. Dr. Patel still does that. And HEDIS, CAPS, and HOS are important, but a huge portion of what we ended up doing, over half, was teaching docs how to understand and manage patient healthcare risk. So again, we talked about this is especially the 5-star piece. Both sides of what we're doing is very, very data intensive. You need people data mining. If you're Joe Doctor out in rural America, that's not likely to happen. So that's what an MSO is all about, managed services organization. And that's what we do. If you have interest in working with us, again, we're the pros. We've done it forever. Raj, how long have you been in that space?
20 years now. 12, 15 years now. Probably total.
So again, managing it for very large, 120, 150,000 covered lives nationwide, 5-star, the highest level of quality. So give us a call at 859-721-1414. That's 859-721-1414.